Tier exceptions. What are they, and how can they help me? And I'm here to talk a bit about that. So, if you didn't already know, my name is Chris, and I've been with CVS Health and Aetna Medicare for the last 6.5 years, working in their Medicare Advantage and Medicaid services. And everything I say here is my own opinion and my own research that I've done over the last 6.5, 7, almost 7 years now. So, without further ado, let's talk about why tier exceptions are no exception to the rule of saving you a little money today. So, tier exceptions are designed to help with the rising drug costs, and not a lot of people know about them, which is why I'm sharing it today. So, tier exceptions, what they are they help bring those high tier drugs, those drugs that are in tier 3, 4, and 5, oftentimes known as specialty drugs, like Eliquis, one of the more common ones. But it helps bring those specialty drugs down a tier and reduce costs for the patients and members of these insurance plans. Now, one of the primary reasons is going to be there is no other drug. There is no generic form. It is only the name brand that treats that specific diagnosis or illness or whatever. You can talk to your doctor. They can put in that tier exception. It's usually cut and dry and really easy to save you some money that way. Whether bringing it down one tier, two tiers, or three tiers will depend on the paperwork that is sent in. The other reason, and this one I wish more people knew about, is when you are getting treated for a specific diagnosis, you can actually request for the name brand, especially if you've already tried those generic brands and they're either not as effective, non effective, or they cause adverse reactions to you when taking it. You can actually get a tier exception that way to bring the name brand costs down and help you save some out of pocket costs and keep that drug covered. Now, it could also bring you a little closer to the donut hole. I can talk more about that later. But as far as the tier exceptions go, it's there to save you some money overall in the long run of your prescription drug benefit. And if you found any useful information in this, go ahead, like, share, comment, follow along, subscribe wherever you are, because I plan on bringing more stuff in the future for everybody to help in your Medicare and Medicaid journey. Without further ado, I hope you all have a great rest of your day. And as always, comment if there's something else you'd like me to talk about. Have a beautiful day, y'all.